So erectile dysfunction affects a lot of men, and it causes a negative impact on the man and his partner. So what are the treatments of erectile dysfunction? How do we start treating a man with erectile dysfunction?
Since erectile dysfunction is a manifestation, at least in some patients or many patients, of vascular disease, treatment have two parts. Number one, treating the underlying vascular disease, and number two, obviously, improving the erectile dysfunction. I'm going to just focus on treating the vascular disease, the underlying vascular disease. There's just really simple steps, 3 or 4 steps that people need to know about. Number one, lifestyle changes, and that's by exercising. 30 minutes walking, jogging a day would be good enough. Obviously, sensible diet, and there's a lot of diets out there. I'm not going to get into that. Number 3, risk factor modification, which means treating your diabetes, treating hypertension, treating high cholesterol. So really, those are the things that need to be done to start with, just to improve overall health before moving on. Not before, it could happen simultaneously with moving on and addressing the erectile dysfunction per se to improve that part of the equation.
So, Dr. Moussa, the treatment of erectile dysfunction is not necessarily only about having a quick prescription or having a pill or having an injection or a surgery. The treatment of erectile dysfunction is really about improving overall health.
Correct, because like we said before, people who have erectile dysfunction have atherosclerosis or blockages elsewhere in the body that could threaten their life in the long term. So it's important to address these things to improve their survival and the way they feel.
So you could imagine the double benefit, for example, from diet and exercise and reducing weight in someone who's obese, or quitting smoking, or being reasonable on alcohol in someone who drinks too much. And you can imagine the double benefit in improving sexual function and in improving overall cardiovascular health. So this is like we say, if you're sexy, you are healthy, and if you are healthy, you are sexy.
That can be more true because it's scientifically true. I think if you do that, you your quality of life would be better, not only from sexual performance perspective, from other heart health perspective.
Excellent. So if we improve the man's health in diet and exercise and quitting smoking and reducing alcohol, and there's still erectile dysfunction, what are other medical treatments of erectile dysfunction, Dr. Carson?
Well, as we all know, the revolution in erectile dysfunction treatment began in 1997 when sildenafil Viagra was approved and marketed in the U.S., and then that was followed by 2 other PDE5 inhibitors, the kind of pills that patients can take for their erectile dysfunction. Those are very effective treatments, and in fact, they're the easiest treatments because taking a pill obviously is a lot easier than some of the other things that we'll talk about later. But it doesn't work for everyone. In fact, somewhere around 40 to 60% of patients will respond to the pills, to PDE5 inhibitors. The 3 that are available currently are Viagra, Cialis, and Levitra. They're all 3 the same class of drugs and have the same potential for effect. If that doesn't work, then we have some other things that we can offer. And one of the important things is normalizing testosterone, because we know that patients that are very low in testosterone may not respond well to the PDE5 inhibitors. And you showed that in some of your own work, that by normalizing testosterone and then re-challenging the patient with one of the pills, with sildenafil, Viagra, that they're likely to have success with their Viagra.
So I guess the study that you're referring to is a study that we did a few years ago and published in the Journal of Urology on the men who have low testosterone and did not respond well to the pills, and giving them testosterone to treat their testosterone deficiency also helped improve the response to the pills.
Yes, and then in the patients that fail the pills, and there are significant numbers of those patients, that we have other options for them. So that's not the end of the story, and that's really a very important message, I think, for our listeners, and that is that if you've tried the pills and tried normalizing the testosterone and still aren't having the results that you want, we have a lot of other options in our armamentarium. The vacuum erection device is a device that's been around for many years. It consists of a syringe barrel type a device that goes over the penis and is sealed to the base of the penis, and then that's attached to a vacuum pump, either a hand pump or a battery-operated pump that draws blood into the penis by vacuum. It certainly is effective for some patients. Many patients don't like it, but it's certainly something that some patients will use regularly. There are other medical treatments that we can use, other drugs that we can use. One is a drug called Muse, which stands for Medical Urethral System for Erections. It's a small pill that goes down into the channel in the penis. And that
channel in the penis, where the urine comes out.
That's correct.
We call that the urethra.
In the urethra. And once that's placed then and activated, patients can get an erection from that. And if that fails, then we can use the treatment, the medical treatment, the drug treatment that's been available since the 1980s, and that is an injection directly into the penis of a single or a combination of drugs, and that's also often very effective. But again, not for everyone.
Now, when we mention an injection into the penis, many of my patients here in our center in New York cringe and say, "Oh, injection where?" So how is that? Is that a big needle, a small needle? Can you explain?
It's a very tiny needle, usually an insulin-type needle, a diabetic insulin needle, which is a very fine needle. The needles that we have today are as non-painful as they possibly can be. And I usually tell my patients that it's going to take you about 3 times to be comfortable with this. We do once in the office to see how it works, and then we send the patients home with it. And once they get the idea that psychologically they can put this small needle into their penis, and they've done it a couple of times, and they become comfortable with it, and it becomes an effective way of treating their erectile dysfunction.
Now, we mentioned earlier in our episode that some men with erectile dysfunction have psychological reasons, such as depression, such as sometimes marital conflict, in addition to the diabetes and vascular disease or radical prostatectomy and the causes of erectile dysfunction. Is there any role of going to a psychologist or to a sex therapist?
I think a sex therapist is an excellent part of this treatment program. And there are a number of studies that have shown that any of these treatments that I've mentioned are better if they're combined with the appropriate kind of counseling with a very good sex therapist. And sex therapists are a critical part of the management of erectile dysfunction in most patients as well as their partners.
So we see now that there are a number of treatment options, or what we call medical treatment options, that are non-surgical options for the treatment of erectile dysfunction, including pills, including treatment with testosterone, including vacuum device, including the Muse or the penile self-injection therapy. Now, how effective is all this? Are there men who do not respond to any of that? And should they be looking for other things?
There are many men that don't respond to that, or men that don't like those particular options. So they may try the injection therapy for a while and say, this is not for me. Or they may try the vacuum erection device and say, this works, but it's really not meeting my needs. And for many of those patients, whether they fail or whether it's not meeting their needs, there are other options that we can move forward to once they've tried these less invasive options.
So men who do not respond to medical therapy may be candidates for surgical treatment with penile implants, and we will be talking about that in the next segment of the Dr. Ridwan Show. This episode is dedicated to erectile dysfunction. It's in several segments, and in this segment we just spoke about the medical treatment of erectile dysfunction. And we learned that erectile dysfunction can be treated by modifying vascular risk factors and improving health, and also by medical treatment. So we urge all men with erectile dysfunction to seek the help of a doctor and to be open and speak about erectile dysfunction. Thank you. This is the Dr. Ridwan Show. Stay tuned and come back to the next segment of this episode on erectile dysfunction on www.drridwan.com.